Usually tells me it's recording. Hang on. Good. Okay. Everybody let me know if you can't hear me, but I'm going to get started. Today, talking about kids in chiropractic. And we're going to cover so many different things as we are going to blend a couple different workshops that we've done as to the importance of chiropractic for kiddos. And so there may be some things that you want research on, or you want us to send you some things on, or you can access after the fact. So if you don't catch anything, don't worry. We have all the research and the resources here for you. So I'm Dr. Kristen. Thank you for joining us. Tuesday night workshops at Monarch Family Chiropractic. We're going to jump right in. When we talk about kiddos, we really always are talking about how it's so important to support their developing brain, right? And it's so imperative in those first couple years that we have the most impact. And so there's lots of in-depth conversation about the brain and in depth with how stress and trauma and just the developing brain is impacted in a lot of the polyvagal workshops that we've done over the last year and a half. So I'm going to just show some brief slides that we're not going to go in depth on in the how and the why and the body's working, but there's different components that the brain has to develop in and develop correctly and have the right input and no stress upon it or trauma with it in order for it to develop, the way it's supposed to in the time and frame it's supposed to. So just looking at a brief anatomy, there's areas that learning comes from that prefrontal cortex. The limbic system is what we talk a lot about because it's affecting that kind of where we process our emotions and how we perceive feeling safe, feeling loved, feeling in a place to thrive. And if we don't, and we're in a place of fear or a place of unknown, then that limbic system and the body and the brain can't function the way it's supposed to, and it goes into more of a shutdown state. So when we're looking at the brainstem in that survival state, it's really, again, it's processing, am I safe? And then the limbic system is doing more the emotional component, right? So we talked the in-depth versions of that in other workshops, but just to recap how important, the brain is in the processing and learning information. And we talk about patterns all the time in chiropractic. It's no different for kids. It's all starting early on for them. So the thread, it really shifts that ANS stands for the autonomic nervous system into states of a defense mode, right? And it can interfere and does interfere with the neurological and the neuropsychological states needed to optimize health. So when we're looking at what happens if a kid can connect and can process, it's how they're processing a threat or a change in their environment. So it compromises their ability to engage, right? And it's replacing patterns of connection with patterns of protection. And that's not really different for us, but if it's happening in an early stage for them, that's imperative that we help shift those patterns and help them get to a place where they can process and feel safe and protected, right? None of us want the opposite of that for them, for any of us, but especially for our kiddos. We're not going to go in depth on the somatic bottom-up approach, but it's just talking again about different parts of the brain. There's a fear center. There's more of an area where we have, the activation or regulation of things. And then the memory center, the hippocampus part of the brain, right? And that increases different feelings. So again, we go much more in depth of how that part processes in our brain. So if there's any of the things we talk about moving forward and possibly symptoms or behaviors that you see with a child, or around or have experienced, then it's worth you seeing the other workshops to pick up this in-depth data. But we're really looking at a hierarchy of the autonomic system and the functions and to behavior. So how the neuroception is how do we perceive things, and co-regulation we talk about is, how a child is regulating. So dysregulation can look like this. A nervous system that is unable to process or really process through an emotion or a situation, a feeling, a kind of behavior opposed upon it. So if a child can be from acting out and aggressive to inconsolable to really shut down, And we talk about those stages and how we get in and out of them, again, in the polyvagal workshops for kids, more specifically for them. But it's really looking at what does dysregulation look like from, in a sense, even a bird's eye view, and what does it look like with regulation? So before we can learn to self-regulate, as kiddos, we must, and all of us, learn to co-regulate. So that ability for our emotions, requires, as it says, typical neural sequence development in childhood, and then that's going to determine how, we can coexist or co-regulate consistently. So it changes the tone of our nervous system. And that's what we as chiropractors pick up on as we're checking, all of us, the kids especially. And as we learn to self-regulate, right, our nervous system by that experience, it again brings calm, regulated nervous system behavior. And that's what co-regulation is. And so think about who are our co-regulators, right? It is very commonly, there's a couple research articles that I don't believe we put in this workshop, but are in previous workshops that really talk about how they were measuring tone and regulation and nervous system input and output, even just in heart rate and fetal responses with babies being able to hear mom's voice, and how important it is for them. A lot of this stuff is all being studied and we see pre-birth, right? So still, this stuff is all taking place in some ways with what the baby hears and that connection they have to mom in utero. So showing that, human development and the abilities for emotional self-regulation through connections is really a very reliable source. And so is it a caregiver? Is it, a parent? Is it, who is their person of safety, if you will? And so that has to be, it's imperative that that happens for them just to have a good sustainable life and have that connection. This is a different research article that we talked on a lot with polyvagal when we're talking about how we see this underconnectivity happening in the cortex if there is with kiddos that are on the spectrum. So we touched on this before, but even just kind of briefly showing that, children's brains showing a stronger connection between the auditory cortex and that subcortical reward center, so different parts of the brain, when hearing their mother's voice, also had the strongest social communication ability. So when we see a kid that is challenged with communicating, challenged with being vocal or verbalizing or putting words to things, there's a part of a dysregulation component many times happening. So neuroception, we spent time in depth on previously, but I think it's, again, good to just recap some of these things and understanding how vital it is for their brain. This isn't, when we're thinking of kids, so much of a physical ailment or pain or ache. It's much bigger than that, and it's, in a sense, much more important than that, because pain comes and goes. Those kinds of things, yes, kids knock themselves around and should get adjusted from birth because they fall off of beds and changing tables, they roll off of things, they, fall off of their bikes, they get thrown by their brother or sister. I mean, just being kids, things like that physically happen. But it's a really important component to notice what are they doing and how they process those interactions with siblings, or an interaction at school or daycare, or an interaction at home, when they're doing things they're not supposed to do, or just engaging in connecting with the family dynamic. So our brain is using internal and external cues to access the response we need. So the neuroception component is really those neural circuits. It's distinguishing situations. Safe? Is this a dangerous situation? Is it life-threatening, or is it just uncomfortable, right? All those things are different and give us different responses. And if we have that neuroception, if we can regulate and our circuits are connecting, then we know the difference. But if they're not, it could be a safe situation and we just don't know it is, or they don't have the sense that it is. Oops, hang on a second. I just lost my mouse capabilities there. Whoops. Oh God, crazy. There we go. So I thought it'd be good to cover some things that you may see, or, why we adjust kiddos and what we see in them and why it's so important to be assessing things with a child and from very early on. So this worksheet is talking about when you're looking at a healthy child and what a chiropractor is checking. And the first year of life, there's a lot of milestones. So I think it's important to understand why those milestones happen, and that their eye subluxation, they can create subluxations often, which would be the chemical stressors, right? A physical stressor, like we just talked about, but the emotional stressors as well. So hopefully you can read some of those. They're in small print with this much stuff. But we really want to look at factors that play a role in care for a kiddo and what we're looking at when we're looking at things from birth, and how it's really important that they are holding their head up at the right time and doing things like tummy time, but that they don't have a tone in their nervous system or in their spine that is too intense. They shouldn't be holding their head up early on. When there's a tone that's very rigid in the spine, sometimes it appears like, oh, they want to sit, they want to stand, they want to hold themselves up already. When they're in those first few months, that's not normal and natural, and they shouldn't be doing it. So it's the nervous system being overloaded and the structure also being overloaded, that it's pushing them into more that sympathetic response, and that tone is too much for where they're at. And so it's a sometimes a process of bringing things into a calmer state before it can go back into an active normal state, if you will, for their motions. But infants are born with only that, looking at that C-shape curvature in their spine. And so when we're getting into that, what we call our cervical lordosis, that neck curve, that second picture is that we're holding a head up and we're rolling over, right? Those are all milestones that need to happen in certain months of life. And it's really those first few months that posterior neck muscles, so the back neck muscles, get stronger and then start holding the head up against gravity. So it's all a component that has to develop long before we do things like a low back lordosis, a low back curve, when that cross crawl motion. So any scooching or crawling is really something that's going to be happening between 6 and 12 months of age. And that cross crawl and cruising is really something we want them to do before they're doing any type of standing or walking. So eventually we're on all fours, and those curvatures have had time to develop and support themselves, which is then what we'll see, which, sorry, you can't read that, it's cut off at the bottom of that lowest picture, that's what we want to see in that succession, really. So at a 1-year mile marker, that should be happening. Things that can create stressors and to that process not happening either in that path or in that time frame, in those milestone timeframes. And again, there's it's okay if it's a slightly slower time frame. It just depends on their size and development and some of these early on factors and how much of their system been bombarded with. So I think the most common ones we see with chemical stressors would be changing in formula, or if you're weaning between breast milk or mom's milk and something else, exposure to things that have chemicals in them. So that can be from the things we clean our house with, or clean, especially when you think about a kiddo. It's what are you doing with your floors and your carpets? That became a big factor of something I didn't think about early on in life, because until I had a puppy and then a toddler. A baby is what I was using in my house that they were going to touch all the time. And the biggest thing that we see is if there's medicine introduced or chemistry in that way, like antibiotics, steroids, vaccinations, medications to mom while baby's still in utero, or even when it's just after, but if they're breastfeeding, baby's getting that chemistry through breast milk. And so if we use things like pain relievers, the Tylenol, ibuprofen, all that's passing to baby, and all that stuff suppresses the body taking care of fevers, taking care of viral bacterial things. So when those chemical stressors are included or brought into the mix, we definitely see a stress into their systems. Their development isn't there to process all of that early on. All of the digestive system, all of that stuff is still developing still after they're out of mom. None of that is fully developed. But the first things to develop is the brain and the spinal cord. And so, looking at what's there first and then what develops after, we have to really think about what it is we're taking care of first and then introducing later. So emotional stressors that we talk about a lot that don't necessarily get factored in as I feel like some of the really early on things. Sometimes separation from mom, if babies have to be an extended time in a NICU or have to be away from being right against mom's chest and mom and dad's chest, heart to heart, skin to skin. There's really attachment things that can come from that and anxiety to the baby very early on. Things that physical things we talked about where those fall into play. I think what you'll see is where we really start to see how we play a factor in when it's time to see a kiddo. So there's lots of different info on this chart, but I'm going to jump ahead past some of this to look at other things for bigger kiddos. But if there's somebody that's in a pregnancy in an early stage with a babe, know somebody who is, there's some really great things that we look at here between their gross motor, their fine motor skills, their social skills, and language. And we're looking at mile markers there from 1 month all the way to 12. So this is a great quick screen that we use with our parents to see if they're on track and if there's something more that we can be doing to help support them. Other things that happen with traumas, toxins, things that what we call the perfect storm, thoughts, traumas, and toxins at all stages really impact the development. And so early warning signs that parents might see or family might see. And I'm going to pull up, we've got a nerve chart here. We put these things here so you can kind of take a glance at what those are. But I want to put them next to this chart. When you see you've all, if you've been in the office, have your own nervous system chart here where we're mapping out where the spine is and the nervous system attached there through the spinal cord from the brain is sending these signals out to these different, parts and pieces of our body and how it functions. And so that left side column, I kind of call this the word chart of the body. The left column there is everything that is impacted and run by those nerves exiting that color scheme there to the left. Everything on the far right is the effects, right? The things we may see or symptoms that may be the effect of a subluxation or some interference on their brain and nervous system. So I think that it's beautiful to just look at this as not always a symptom you might expect to see, or that it's something, again, that's pain. But when we're talking about anything in that C range, right? The C1 through C7, that's everything in that first box. And it's running, again, that autonomic nervous system, the vision, the balance and coordination, speech, immune and digestive system is huge from that area of the spine, and the vagus nerve, and obviously brainstem, eyes, ears, nose, throat. So things that I think parents may not associate to subluxation or to a stress upon the brain and nervous system that we can support is things like colic or, the excessive crying, latching or tongue tie issues, ear or sinus infections. The torticollis is really just when you see a head tilt in a child or where they can bend one way and they really can't straighten or bend the other way. Things that look as far as sensory or on the spectrum. So behavior of hyperactivity or disengagement, ADD, ADHD, things like that as a child is getting older. Even things like balance and coordination, and again, some speech delay. But if they're not regulating, right, that social and emotional regulation. As we get into the middle part of the spine, all of the T's, I think it's, purposeful for us to think about kids being around things and being exposed to things to have a built up immune system. And are they someone who has a chronic cough or cold, or RSV or bronchitis, or things that are asthmatic, even things like eczema, when you see conditions on the skin, there's a disruption in the system there, and that you'll see down further in the list. So as we look at things that are more in that lower back or with the higher T numbers, right? T12, L1 through L5 or S1, we're looking at things that are really impacting the processing our body's doing. So when we see things in the T range, a lot of times that's when there's a disruption with the digestive system. And that does start high up into the neck area, but it also is much more through that midsection of the body. So when they can be very colicky, or issues with just, and sometimes that's just being noticed by them laying down and not being able to be comfortable. If they arch a lot, that is a sign through the nervous system that is, it's under stress. If there's a delay in some of those milestones we just briefly went over, in crawling, in walking, in even just feeling comfortable rolling over and holding the head up and doing tummy time. Again, as we get into an older range of kids, sometimes what it is they'll go into a period of bedwetting long after they've been potty trained, and been able to sleep through the night. So those are, again, disruptions that happen a lot of times with more activities where they've landed and fallen, and there may be more of a physical component that's created some of that into the lower back where they can't, they're waking up wetting the bed all of a sudden and they're 6, 7 years old, not wanting to go on a sleepover with a friend because that's starting to happen at night and they don't want that to happen. I've had a couple kids have that instance where that's where how mom found us was, I think there's something that's happened maybe later on or something that we didn't catch early on, that created a change in their behavior, right? And I want you to just notice as we click on to the next slide that really what has the most impact, that we spend the most time assessing with a kiddo, is the top and the bottom, because if you understand that feedback loop, there's a big connection between the brain and the upper neck and the lower part of the low back and tailbone area, the sacrum. And so those two areas really talk together, and that loop of information has to come down from the brain, down through that lowest part, and then back up through to the brain to tell the body what it did. So there's more similar patterns in what we see. If there's a disruption in things at the upper area of the spine and head and neck and the lower like tailbone. So some of those things you see kind of cross over, and that's because there is a big crossover between those sections. And they're the areas that are most impacted by that parasympathetic part of the nervous system, which is the calming part of our nervous system. Our vagus nerve is that longest nerve that is really a calming, regulating part of our nervous system. So when we see any of this dysregulation, we want to be supporting and bringing that parasympathetic system back online if it needs to be, or sympathetic, depending on the state the kiddo's in. And so it's really great to assess that so we can see where we need to be, and what's impacting the child in many ways. One other thing to talk about before we kind of come into things that you may see as we get into an older kiddo, why might it also be important to still be getting adjusted or to be getting checked, right? Is now they're being more, they're growing into their bodies, they're hitting puberty and hormones, their musculature is developing, they are sitting in school for 6, 8 hours a day, they are carrying heavy backpacks that shouldn't be, more than I think it's about 20% of their body weight, or less. And that's not what we see with kiddos, or they're wearing something that doesn't fit them right, like this picture. So there's a lot of ergonomics we can talk about with kiddos as they're getting into school age. They're going to start eventually playing probably some version of a sport or activity. And it's all about what the movements that they're doing, and how coordinated they are can be a part of how well their system understands what it's doing in space, right? Just like with us. And so teaching them proper ergonomics, teaching them proper postures, teaching them proper ways to carry their backpack even, are super important to instill those habits young, so that we're not seeing this forward head posture, low back pain, very, I don't want to say dysregulated, but very asymmetric just structure and way in which they carry themselves, in the postures that we see our kiddos in, right? And so looking at how, even if it's just that we have a backpack, but they're not wearing it the way they should. So the little things like this that we can do that really support our kids in posture, which is such a window to the spine, and what stress it puts upon the nervous system on top of all the other things we just talked about that can cause that. There's a great article that Doc referenced in a workshop called Our Wellness Journey, I believe. And I think it's actually from last year or the very end of 2022, but it's so we've got that research if you'd like to see it. I don't believe we put it in here. We put the vagus research in here, vagal research. But this is two things talking about how showing that, again, characteristics with that low vagal activity, that low tone in that part of the nervous system that helps regulate. You may see different, even just facial responses and visual things. So, very flat facial expressions, or they really don't express much that way. Difficulty in vocalizing things and having that social auditory information. And we see other things with cardiac, like parasympathetic activity. So different ways we measure things like that. But low vagal tone can be improved, and that is something that every time you're getting adjusted, we are supporting and raising up the tone of that nervous system functioning and acting like it should. And so looking at different things that would create social engagement, feed, forage, and friends, right? So there's some different at a quick glance, or you can screenshot that if you want to, or take a quick picture, things you want to see in body, touch, face, eyes, voice. And that is just showing a regulating nervous system. Things that are, again, more sympathetic, more fight or flight, more aggressive or defensive in nature, or when a system is dysregulated, is these types of tones. And so all of this can be supported by supporting them in removing the interference that subluxation can cause in the birth process, in the growing process, in just what they're exposed to as little kids. But again, from physical to emotional, and the connection that is made early on in life. So these can be some things that you can also just watch for. And if you see, knowing that their system is unable to regulate, know that we can support that. There's also a phase of shutdown, and we won't get into any of that tonight, but that's if you're into a place of seeing this, it just has to be addressed in order to get them into a state of even responding. So we don't want to see anybody at this stage, especially our kiddos. So in order to support this, we've got to come out of the shutdown phase before we can get into a regulatory stage. And again, all the movements that we did in the polyvagal kind of talk about how we help bring kids out of that state. There's different version of how we look at how to help the kids regulate. Again, just something we addressed a little different in a different workshop, but the study that I want to end with was, comparative studies showing health status of children raised under healthcare models of chiropractic and then allopathic medicine. And so that the research articles put up in that older workshop, but we can certainly share a copy of this with you if you so choose and want to read or hear more about that. Chiropractic children showed 69% of different of a response versus when looking at childhood diseases, things like ear infections, things along sinus infections. A lot of children in the medical, model are at a higher rate of seeing immunizations happening. So about 95%. A lot of chiropractic children or families raised in that from early on have less of them. They say about 25% of kiddos. So I think that when we're looking at what antibiotics and what different medications are, when they're put in the system early, there's effects that are shown to be different in how a child's immune system functions. It's cool to see that the response of chiropractic children in receiving care, where medical children having a response to things are just different. Different swings from 10, 20% to 60, 70%. When pediatricians were talking about the likelihood to feel that every child would have been on course with antibiotics at least once, they suggested that 100% of children suffer from either otitis media or things with ear infections and that type of thing, where there wasn't that same reportance of high probability and high documentation of they going to a doctor for those kinds of cases when they've not been under the same type of treatment or the same type of regimen, if you will, of medications. There was different other notes done by the authors that did this study. But even just literally comparing children adjusted versus children not adjusted, the percentage of kids that were sought out were for medical care was 42% versus 96%, who were under more medical protocols, if you will. 90% never really using any antibiotics or drugs in that first year of life. 70% was in that realm for medicine. Never using antibiotics, it was a 49% versus a 12%. Having allergies, that was pretty consistent across the board. But things like tonsillitis, otitis media, asthma, occurrence of, what was interesting is seeing occurrence of like mumps, chickenpox, and measles be within like 1 or 2%. And so not a huge swing or difference there in people in the two different paths. So just showing less infections and less inflammation, and that the immune system seemed to be better able to cope with allergens, things like pollens, grasses, than some of the kids raised under more of an allopathic model. So I think it's just looking at what we're exposing ourselves and our children to, and what's the response of the body that way, the response of the immune system, whether it's to be helpful or to put stress upon it. There's lots of different percentages along the path of when kids were tested for similar things, but didn't have similar responses and didn't have similar interactions. And so I think there's just a point in looking at if a system is being bombarded with something, but at the same point may also not be receiving support of the nervous system. It's not a all or none or a right or wrong. It's the sense of, are we giving our kids support that they need on top of what we may think we need to be doing medically for them or putting into their structure. So if it stresses the structure or it stresses the brain, how can we support that, even if that's a path we're choosing with the allopathic model? It still doesn't discount that. How can we best support them processing what we're putting into them and what we may be exposing them to as they go into school, as they go into being around other kids, as they go into be around other parts of the community. So hopefully this gives you some insight as to what to look for, gives you insight to see what it is we check for, what it is that we can help with when we are seeing these things show up early in life, so that hopefully we are having, young, thriving, amazingly responsive children for the legacy that we want to leave. So please come in and give us your takeaways. We want to see them up on the education station in the office. And if you have any requests for any of the research or any of the articles I referenced today, or that we have in previous workshops, please let us know, and Jesse will pass those on to you. So thank you for joining us tonight and learning more about kids in chiropractic and what we look for and how we can support their systems being amazing. And we look forward to seeing you in the office. Reminder that next week is our Patient Appreciation Week. And so there are slots for new patients throughout Monday through Thursday available. And that is a week when we do at our expense any of our consultation histories, exams, and x-rays if needed. So it's a great time to have kids checked at our expense. It's a great time to have any other of loved ones that you know of, that you're thinking of, that may want to know more about their bodies and how they work and how well they're working for them, to get checked. So just call the office, let them know that it's our Patient Appreciation Week, and when those as the slots are open until they're not. So we were happy to serve you in our community and our family in chiropractic to help others seek out the best for their bodies and their brains. So thank you for joining us tonight, and we will see you next Tuesday.
Thanks.
Bye, everybody. That is you.